Joining us now in the studio is Dr. Ahmed Bakr, who's a paediatrician at the Al-Ahli Hospital here in Doha. Doctor, thanks for joining us. How does this test work? Does it involve any expensive equipment?
No, nothing expensive. It's just a quick checklist, 24 questions that the parents can look at and answer in less than 5 minutes.
Okay, so it's the parents who take the test and not the child.
Right, absolutely. Okay. The parents will be asked about some in the behaviors of their child when they did produce the first babbling sounds, the gestures, the social smile, the reactions to different things, wording, and so on. So the parents would fill in the test, and among the 24 questions, actually, there are few critical items and some other regular items. If the response is failure on 3 or more, then the doubt is high, or if you fail in 2 of the critical items. And then we don't really diagnose autism, but I mean the index of suspicion would become high, and then you would refer such a child for more detailed testing.
It sounds such a simple idea. I'm amazed that it hasn't been thought of before.
Well, actually, it was implemented before. There was a test called the MCHAT, which is the modified checklist for autism in children, but it was usually taken for older children. The thing is, the autism usually, as you have just said, is usually not diagnosed until later. But recently, it was diagnosed at around 2 or 3 when the full-blown picture is there. So the idea of the test was to detect it with more subtle signs and symptoms rather than waiting for the full-blown picture to appear.
I'm interested to know, I mean, many of us will know a family that has been touched by autism, that there will be an autistic child. In your professional experience, is autism as a condition that's more common today, or is it just that we're better diagnosing?
Right. As you have just said also, the US has said that 9 out of 1,000 children, they have a touch of autism or the autism spectrum disorders. I mean, the full-blown picture of autism is not really common, but having some of the features of autism is really common. So the awareness about it, so taking your child to the specialist to diagnose, plus we believe that also recently there might be some factors who have increased the incidence of autism. So both play together, the more awareness, so more diagnosis, and maybe some environmental factors have contributed to increase the incidence of autism.
Doctor, it's been good to talk to you. Many thanks indeed for allowing us to tap into your expertise. That's Dr. Ahmed Bakr there from the Al-Ahli Hospital here in Doha.